My research focuses on primary health care, looking at how the rollout of health services to different populations are having an impact on their health. So this might be looking at how the family health strategy has improved individuals' health, for example, their cardiovascular health or diabetes control, or looking at how things like infant mortality have fallen in response to expanding the primary healthcare program in Brazil. Why did I choose Brazil? I think Brazil is a great setting for looking at primary healthcare. Brazil has had a large commitment to expanding primary healthcare under the family health strategy. I love working in Brazil because the researchers here are extremely open for international collaboration. They want to learn from international experiences just as much as we want to learn from the Brazilian experience. I think one of the most important things about SUS is that it's a national health system that a lot of people have faith in. A lot of people that I meet at OPAS and the Ministry of Health believe in SUS and future development of SUS, and they believe that the SUS can improve and get better and overcome a lot of the challenges it currently faces to improve the health of the Brazilian people. I think specifically, one of the most important things is the belief in the system, which other countries can take away. I think there's a lot of commitment to the SUS from different ministries and different organizations. I think a lot of the principles that SUS was founded on, including equity and the provision of health to everyone, are really important. And these are really great principles to build the health system on. My research has looked at different health impacts from expanding the primary healthcare program in Brazil. A lot of evidence already exists on this, and it's quite famous in the international literature, showing that the family health strategy has reduced infant mortality, and it's also reduced mortality from cardiovascular disease in adults. My research has looked at trying to explore the differences that are occurring in Brazil. Brazil is a huge country, and there are so many differences in the family health strategy across the country. So one of the first things I've looked at is to show that areas where municipal governments have good control over their health systems, we find that the family health strategy is a lot more effective at reducing mortality. So good governments, good municipal governments, can lead to good primary healthcare services. The second thing that I looked at was looking at whether the primary healthcare program has reduced inequalities between people, between different racial groups is what I've looked at. And this is quite a maybe politically sensitive topic, as looking at people by race is not the best way of doing research. But because there are such large disparities in Brazil, we decided to look at it anyway. And we found that actually the populations which have benefited the most from the expansion of the family healthcare program are those of Black and Pardo ethnicity, which we take to, given that a lot of Black and Pardo populations are in lower socioeconomic classes, we find that this has reduced inequalities in Brazil because the most poorest and the most vulnerable populations have benefited the most. I think, given the current political and economic climate in Brazil, I think the most important thing for maintaining a good trajectory in increasing coverage is to maintain political commitment to the SUS. And this isn't just political commitment from the federal level, but it's from municipal and state level, but also in the wider society, the civil society, and really pushing forward the agenda for SUS and ensuring that the the gains that have been had through important policies such as the family health strategy, the Mais Médicos program, are not eroded, and that they are continued to be reinforced and built upon. I think it's a great opportunity to bring a lot of different people around the table from different backgrounds. So people from universities, people from the Ministry of Health, politicians, from international and Brazilian backgrounds. So having discussion about the challenges the SUS faces for the future, I think it's important to bring out lessons from other settings and devise opportunities for the SUS to overcome these challenges. Commemorating 30 years of SUS will be important for not just Brazil, but also the international community. Brazil has given so much to the world in terms of health policy lessons and major improvements in the health of the Brazilians. So Brazil can show a lot to the world, but likewise Brazil can also learn from other opportunities.